Late last summer, as the media was reporting on how evangelical Protestants were less likely to have received a COVID shot than other religious groups, the Biden administration sent out National Institutes of Health Director Dr. Francis Collins to appeal to evangelicals, claiming that the main reason for them not getting the shot was, quote, disinformation.
We do still now have this serious issue right now about vaccination hesitancy, and certainly evangelical Christians, and I am one of those, have had a lot of trouble in many instances rolling up their sleeves. Lots of reasons for that. Much of it is this disinformation that is so widely spread on the internet and which has, I think, caused a lot of people to be confused or fearful about what the vaccinations might do to them.
Like Dr. Anthony Fauci, the president's chief medical advisor, Dr. Collins was presented as someone who represents science. And going further, Dr. Collins was presented to evangelicals as one of us. And as my next guest has noted, quote, the editors, writers, and reporters at Christian organizations didn't question Collins any more than their mainstream counterparts questioned Fauci, end quote. But should they have? Joining me now is the author of the provocative and important article, How the Federal Government Used Evangelical Leaders to Spread COVID Propaganda to Churches. It's Megan Basham from the Daily Wire. Megan, welcome to Washington Watch.
Thanks for having me. I enjoy being here.
Well, we are so glad to have you. There's a lot to unpack here. Let's start by talking about who Francis Collins is.
Right. So Francis Collins is he recently departed. He recently resigned, leader of the National Institutes of Health. So Francis Collins is one of the highest medical officers in our nation, one of the most powerful bureaucrats in our nation. And he was presented to the evangelical world as a man of great integrity, a man you can trust, as you said, someone like us. And he was presented as a man who believes in the sanctity of human life. That is not who Francis Collins is. When you dig into his record, he is somebody who has quite strenuously argued for fetal tissue research, for stem cell research. He has declared himself an LGBT ally, an LGBT advocate. He has directed a lot of funding into that. So I think that what we have to say is that he was presented as something that he was not, and that is a basic Bible-believing Christian. Now, I'm not questioning his faith, but I'm saying that his views depart very strongly from your average person in the church pews.
Now, your article really does have the receipts with respect to the things that you just made, and I will commend people to find that if they have questions about where these accusations are coming from. He has a long history in public life and public health, and much of his work is documented and documentable. Now, given the allegations, which are serious for sure, regarding his positions on life, regarding his positions on the LGBT issues, why is it that so many churches, Christian organizations, Christian entities open the doors for him despite his record?
Well, part of it is I think he had really deep roots and friendships with a lot of powerful figures in evangelicalism. If you read my piece, you'll see that he is friends with Rick Warren, that they met at Davos, the World Economic Forum that is put on every year for billionaires and heads of state. He is very good friends with leaders like former ERLC head Russell Moore. He is friends with Tim Keller, with N.T. Wright, and particularly Ed Stetzer, former Christianity Today editor, head of the Wheaton College Billy Graham Center. He is now at Outreach Magazine. So he has a lot of really strong connections with powerful figures in the evangelical world. And what's funny is that this was not sort of a secret thing. You had very public, secular outlets reporting on Collins, saying that he was making the rounds to evangelical institutions, speaking to them, trying to convince them not just to get the vaccine. A lot of the focus has been on that. But in fact, he was doing a lot more than that. Part of what he was doing was trying to convince churches that masks save lives, masks are life-saving medical devices. That's a direct quote. He argued for masking children. And then this one gets really complicated. Part of what he sold in Christianity Today webinars, in partnerships with Health and Human Services videos with Rick Warren, was this idea that the lab leak theory was a conspiracy, that it was a conspiracy theory and it was sinful for Christians to indulge in that type of discussion, to spread that sort of thing online. And you saw a lot of opinion pieces that went that way, that framed it as a conspiracy theory, as very QAnon. Well, of course, we know today that not only does it turn out that the lab leak theory is probably the most likely explanation for the coronavirus's origins, it also may have been developed with funding from the NIH, gain of function funding, which means Francis Collins had a direct interest in suppressing that type of news. We know Anthony Fauci, through leaked emails, helped use media contacts in the secular world to suppress that. And now it looks like Francis Collins may have been doing the same thing with Christian media and captive Christian audiences in churches, as he was urging pastors to combat misinformation and encourage pastors to put out the government's narrative on COVID.
And one of the interesting points in this, and you mentioned how the argument he was making was that it was sinful to essentially say that this could be a lab leak theory. Now, how did that play with the audiences that he was speaking to?
Well, I mean, it'd be hard to know how are the people who were reading it or listening to the podcast, how are they responding? I think if you looked on social media, you kind of saw that a lot of people pushed back against that and maybe didn't immediately accept that narrative. But the Christian elite media outlets, they didn't push back. They didn't say, this is one potential voice we may listen to. This is one medical expert, but there are other medical experts that might have different views on some of these issues. They didn't do that. They pretty much only platformed Francis Collins as the authority that we should all look to, because they said he's a Christian brother. He believes in the sanctity of life. He's like you. So you can trust this guy. You can trust that he's giving you the real information. So I think a lot of people did feel somewhat shamed. I think they went, oh gosh, maybe my aunt posted something on the conspiracy of the lab leak theory, and they would maybe feel bad that they indulged in that. So there was also this sense of sort of heaping shame on average people for discussing what was a very reasonable hypothesis.
Now, of course, these issues, whether it's should you get the vaccine, should you wear a mask, have been hotly contested since the beginning. We spent 2 years debating these things. Is there a sense that the outlets that platformed Dr. Collins, was this just a pastor who had that particular conviction? This is somebody who was going to agree with him from the federal government and give his belief that you should get vaccines credibility? Or were these people who were generally presenting information, allowing people with a different perspective to speak? Or were they really just using him to kind of encourage the position that they appeared to have?
I can't say for sure on that. My impression as I was doing this reporting was that the NIH was reaching out to them. So part of what you see as you look into the story is Ed Stetzer, for example, at Wheaton, at the Billy Graham Center. He directly said that we partnered with the CDC and the NIH. So my impression of that was that this was the federal government coming to them and saying, can we use your pulpits? Can we use your platforms? And part of the reason is when you listen to the podcasts and the articles that I linked to in the article, Francis Collins was very clear. He said, I am exhorting you pastors, please get your church members to do this. Please get your church members, not just to get vaccinated, but get your church members to stop fighting back against COVID lockdowns. A lot of these, for example, an interview that he did with Timothy Keller, they sort of sneered at the churches that were starting to meet again. They called them the bad and ugly, good, bad, and ugly responses to coronavirus lockdowns. His segment with N.T. Wright, they kind of made fun of churches that were meeting, saying that these are people who believe that Jesus is my vaccine, or that Satan can't get into my church. So I would say there was agreement there, but it was also very much using it to spread the ideas that the federal government was already telling all of us. I mean, we can remember, right, that we were being told, gosh, we know it's hard for you churches, but you shouldn't meet. We know it's a struggle for kids in school, but they should just have to wear those masks because that's following the science. Today, we know that's not following the science, that these are largely debatable issues. And I would say they're still debatable issues, but the point was that they were matters of Christian liberty. They were matters that could have been left to individual conscience. And that wasn't what happened. We were told that this is loving your neighbor. This is one leader directly said that wearing a mask is following Jesus. So we can see a lot of legalism and heaping of kind of a lot of law on people's shoulders in this.
Yeah, to that point, whether this is following Jesus, whether this is loving your neighbor, we now have the benefit of hindsight in some things we've learned. We haven't learned everything, but we've learned some things. And is there at all, what would you say to the allegation that, well, had the vaccines worked like they were supposed to and had masks worked like they were supposed to, they would have actually, they may have saved more lives than they ended up saving. Would that have changed the way we evaluate this looking back, that we would all agree, yeah, it is loving your neighbor if it was the Ebola virus and stop people from, 50% of the people who get it from dying?
Well, not really, because here's the point, is that it was very early on. These were a lot of, to borrow the Donald Rumsfeld statement, that these were a lot of unknown knowns and a lot of unknown unknowns. So there's a lot of things that we did not know. And there should have been some humility in that. There should have been some pause and go, look, we're going to pursue the best policies because we believe right now that these are the best health policies, but this is evolving information. You didn't need to link it to, is it sinful or not sinful? You didn't need to link it to this sort of spiritual maturity. And that's what you really saw. It was a measure of how good of a Christian are you if you're not following these rules, or forget not even following them. How good of a Christian are you if you're discussing them? If you're discussing them amongst your friends, well, then you're spreading around conspiracy theories. And that was kind of the main angle of the story, was that there was just no grace. There was, from a journalistic point of view, from a lot of these Christian outlets, there wasn't even any reporterly curiosity to go, well, what might, say, another medical expert think on this subject? Because even way back then, there were a lot of really credentialed medical experts saying, we're not so sure about this mask thing. We don't know that cloth masks, the way they're worn, really have much effect. Today, we're finding out that, hey, actually, there might have been a reason to listen to some of those other experts. So I think from the beginning, if you had just added a little humility to the discussion, a little like, we're not sure, maybe we should open the discussion, maybe we should follow Proverbs and have many counselors. Maybe we should follow that idea of the first person to state his case seems right until another person comes along and cross-examines it. The federal government, through Francis Collins, was trying to shut down that cross-examination process. And these Christian outlets and these Christian elite figures help them do that.
We're talking to Megan Basham from the Daily Wire. And Megan, have any of these, and again, we're Monday morning quarterback a little bit, but we're still looking forward. And you talk about how the facts have come in and things are different now. Have any of the people who platformed Dr. Collins, who really were aggressive, in some cases religiously aggressive about the fact that people needed to wear masks, get vaccinated, has there been any reconsideration from some of these voices where they look back and say, yeah, maybe that wasn't exactly the right approach to take?
Well, and so that's part of this story that's really disturbing, is that no, there hasn't been any of that. And not only has there not been any of that, things that they now know that they were directly wrong on, like allowing Francis Collins to sort of spread this notion that it was a conspiracy theory that the COVID might have originated in a lab. Those articles have just disappeared. And as a longtime reporter, I can tell you that's not journalistically ethical to just make an article go away with no mention, no editor's note, to just pretend that it didn't exist. Turned out you could still get it on a web archive. And so I go and I dig up these articles and I go, so they clearly know that they were wrong to have put that in the realm of conspiracy theory, but instead of acknowledging it, they've just made the articles disappear. I tried to call the men that I talked about in this article. I tried to call the men that platformed Francis Collins and who I quote, to ask if they've had changed views, if they've shifted their thinking at all. None of them would talk to me. None of them would respond. A couple got back through assistance and just said, I can't answer you right now. Some never responded at all. So I think that's part of the problem, is that the tendency at that level is to just sort of wait it out and hope that it goes away. And that's not leadership.
Megan, what's the lesson for you in all of this?
really the lesson for me, and I kind of go back to that Proverbs thing, is look, I wouldn't have said that I know. I was very sort of agnostic on masks. I wasn't sure either. And I think all of us sort of felt that way. And so that was part of why you go, that's why you want that many counselors. That's why you don't look to one authoritative figure to give you every medical pronouncement that you should be looking for. I mean, yes, we want to obey our government and we want to live peaceably and follow laws, but we don't have to be simple-minded. And that was kind of what they were asking us to do, is to be simple-minded and just blindly follow one man's word. And it turns out that wasn't a great guy to be following his word. Yeah. He has a pretty complicated record.
The article is How the Federal Government Used Evangelical Leaders to Spread COVID Propaganda to Churches. The author is Megan Basham from the Daily Wire. Megan, thank you so much for taking some time today, and thank you for your hard work on this. It is an important conversation. Appreciate you very much.
Thanks for having me.